1450 WOL, where information is power.
Yes, indeed. All right, everybody, we're back live here. We're located in Washington, D.C., but we can be heard all across the United States. This is the Sea Island Morning Show with Bennett and Brown. It's an awesome Monday, and we're here live with Dr. Plummer, baby. Dr. Plummer, we're going to be talking all about dental spa and oral health. And I was just told, Dr. Plummer, during a commercial break, we get all the texts and calls and Twitters. And the first thing I got, Dr. Plummer, my mother said, stop saying stinky breath, say halitosis. So I'm so sorry for all of my people. Listen, Dr. Plummer, the station, most of our listeners are seasoned listeners, but now that the Sea Island Morning Show is here, we bring a whole crew of the 18, 19, 20-year-olds. So that was the reason I said stinky breath, but I won't say stinky breath no more. It's halitosis. All right, Dr. Plummer, I want you to finish that statement about the dental spa because we have lots of questions for you. Okay. So I wanted you to go ahead and complete what you were saying before we had to go to the break.
Sure. So what I found was if we incorporated some reflexology, so maybe for some of our listeners, reflexology is just basically it's a little bit more than a massage of the sole of the foot.
Mm-hmm.
It's a very relaxing experience, actually. And what we found with certain pressure points, we're able to actually lower blood pressure and lower anxiety. So when we kind of started incorporating that first with our treatment, and we found that patients had an amazing experience. The anesthetic lasts longer. The blood pressure was always lower. The anxiety, to coming back to a second appointment was higher. So it really worked out well, and so we just kind of expanded on that idea and incorporated massage and facials and things of that sort.
I think that's absolutely awesome. I tell you that I need to go to the dentist, and one of the things that the first thing, and I want to know, I really want to know
that's
this.
Loaded.
I really want to know this. Tell me I'm assuming maybe you already answered that with the spa service, because I'm thinking, how are you going to lure me in the dental spa when the first thing I can think about is that long needle?
Well, when I give anesthetic, you don't see the needle.
Why?
Wow, okay.
So
where are you located, Dr. Plummer?
We are located in Houston, Texas.
Okay. All right, Houston, Texas. So all of my Houston, Texas listeners out there, Dr. Plummer said you can't see the needle, so I need you to set an appointment to get that teeth together.
How do you do that?
I just have a couple of distraction techniques that I use. I don't let the patient see the needle because that's really scary.
That's awesome.
Yeah, it's really uncomfortable. And my chair, so my assistants, we're big on having babies in the chair. So we understand that anxiety is the biggest thing. It really is. And dentistry doesn't have to be painful. And that's the other thing that I would love to drive home is a lot of patients think of us as being painful. But if we take care of things preventatively, then the pain element really isn't there.
Mm-hmm.
Okay.
That's good.
But I heard you say about halitosis and about how to talk to your friends.
Yes, talk to me.
One key thing that I think a lot of us as African Americans, just general in the public, is that periodontal disease is so high. Mm-hmm. And the reason why people have bad breath or halitosis is because of periodontal disease on some level. So periodontal disease is just an extension of gum disease. So, bleeding when you're brushing, bleeding when you're flossing, just a kind of a weird, interesting taste in your mouth that you can't really identify.
Okay.
So these are the symptoms.
Yes, and so what I ask patients, when you brush your teeth, when you spit, the toothpaste in the sink, do you see a little bit of a pink tinge?
Yes. And I see more of a pink tinge. I see blood.
Yeah, well, that's definitely indicative of periodontal disease. And so patients sometimes think, though, the more they floss, the more they're going to bleed, and it's detrimental. Oh. But what they don't understand is that the body's natural way of cleansing that area is by bleeding. Okay? And so when you see that blood, keep on flossing, because what you're doing is your body's kind of cleansing away that bad bacteria. To allow that tissue to heal nicely.
Okay.
Well, I have a question for you.
Sure.
A lot of people not only are afraid of the dentist, but they don't know how to choose one. So what are the certifications we're supposed to be looking for? Because there's so many.
Sure. where they got their training is probably really important. So you do want to ask what school they went to. That's important, I think, across the board. You want to choose a male or a female. That's believe it or not, a big deal because sometimes men deal better with females and vice versa. Women typically have smaller hands. And we're typically a little bit more nurturing, so to speak. So it really all depends on that. You've got to kind of make that decision. If it's for your family, you need to know if it's a family-oriented practice or if it's more an adult facility. In our practice, we don't have a specified specialty for cosmetics. So if you want for specifically going there for veneers, or crowns and bridges, things more in the aesthetic zone, in your smile zone, then you want to see what type of training, extended training they've attained in cosmetics.
Are there any key things that would give us a trigger that this is a good dentist?
Well, now in the world of the internet, you can always Google them.
Okay, to see what other people are saying.
Yes, and see what those, kind of see what people are saying. People can kind of say certain things based on personality, but you want to kind of, be careful when you're reading those notes and kind of make sure that it's more of a clinical, comment
based on the result rather than
a personal, you know what I'm saying? I mean, all of it's important, but if you want to know if they're clinically sound, then you want to, then you do. And you want to also, when you go for a consultation for cosmetics, once you go in the office, you want to make sure you ask questions that make the dentist make you feel individualized and important.
That's good.
You see, if you go in there and they make you they put you in like this bucket, or this grouping, it probably isn't a great decision just because every patient I have is special.
Right.
An individual, and they've got an individual need. Some patients I can't lay all the way back. Some of them want to be with the door open because they're a little bit claustrophobic. You've got to kind of know those specific things about that patient. Some of them want to be in a private room versus in our open bay area. You know what I mean?
So this is about bedside manner and patient care.
Yes, it is. It really, really is.
Well, Dr. Plummer, it sounds like that the passion is really there in reference to your business and the things that you do. Talk to me about how I'm sure your father is just overjoyed in reference to him being a dentist and you're being a dentist and all of that. So do you guys work together or how does that work?
Ironically, yes. In the last 2 months, he is
okay.
Yeah, he is semi-retired, and I just opened a Houston location. My original office is in Pearland, which is not too far. He closed his office down, and he's now with me.
Oh, that's awesome.
Yeah, okay. It's been 3 months. It's been really great.
Okay, now, Dr. Plummer, now tell the truth. Now, listen to me. Now, I'm the founder, CEO of the Bennett Career Institute. My mother is semi-retired. She works there, as well as my stepfather, as well as my sisters and brothers, and I'm the youngest now, so keep all that in mind. So now, Dr. Plummer, now, how many times have Dad came in and said, okay, let me see what you're doing, looking over your shoulder? Does he do any of that?
All the time. All the time.
I knew it.
It happens. But the cool thing is he asks me questions too because I'm doing a lot more in aesthetics. Just like you probably do a lot more, with what's available to you now.
Yes.
And so it's nice because you can kind of work as a partnership. And I think that's what we're supposed to do.
I think it's absolutely awesome, and we definitely, a lot of people, Dr. Plummer, we get a bad rep a lot of times in reference to Black-owned family businesses. And I think that I get excited when I hear the ones that are doing extremely well, like the Bennett Career Institute, because it's a team effort.
Yes, definitely.
It's a team effort. So now talk to me really quick. We have to go to another break, but I want to know about Career Smiles, the nonprofit that you organize. Talk to me about that.
Okay. I'm not sure if you guys remember or not, but about 8 years ago, the government implemented a welfare to work program.
Yes.
Right. Mm-hmm.
And when that happened, the vocational schools blossomed.
Mm-hmm. And,
a lot of these young adults were able to go back to school to get a trade. And so when that was happening in Texas, a teacher called me, actually a placement advisor called me and said that she was having a hard time placing her students with jobs because they were in a situation where they had a gold crown at the front of their mouth, or incredibly bad gum disease where the gums are bleeding and their breath smelled poor. And these are front desk positions, right?
Wow.
Or dental assistants or medical assistants, receptionists, things like that. And so I went in and talked to her and interviewed with her a little bit more, got some more information.
Okay.
And I put together a program of a seminar called Smile Exudes Confidence.
Smile Exudes Confidence. We're going to stop right there.
Okay.
And we'll be right back, everybody. We're live with Dr. Plummer, the Maxwello Dental Spa and Wellness. We'll be right back after these messages.
1450 WOL, where information is power.